What did you make of this whole story about this little boy, this 4-year-old lad?
Well, it's one of those stories that I think a lot of your listeners will have personal experience of. Wait times have gone up in the NHS. There have been some very serious cases. Medical experts concluding, in fact, yesterday, putting out a report that almost 5,500 deaths over the past 3 years are to blame on wait times of more than 6 hours. What happened specifically is it becomes one of those symbolic moments that combines two things, the fate of the NHS and trust in Boris Johnson, because he literally tried to bury that picture by sticking it deep in his pocket and refusing to look at it. And that raises at a personal level just a question of whether someone can engage with the emotion and can engage with the issue as well.
Well, that's it. It was an empathy issue. It was more of a sort of a bizarre reaction.
Yeah.
We say Matt Hancock, the health secretary, had a sort of far more normal reaction to this. Yeah. And yet the Prime Minister had already talked about this today. It wasn't that he didn't know about the story. It had already been discussed. And we all have to stop this pretense that these people are not shown the front pages of national newspapers when they know they're going to be asked about them. But there have been some questions raised about the fact that there's some claims that this little boy was treated on the floor. Quite a lot of medical professionals have been saying there's nothing there suggesting the child was being treated on the floor. The oxygen mask looks like it's been placed there. That a child wouldn't be lying down if they were suspected of having pneumonia. Some reports that, again, unconfirmed, I must stress, unconfirmed, that the mother placed the child on the floor. I mean, she said, look, they were waiting, and the hospital has apologised there wasn't a bed in the ward, but it does appear to be the wheels of a trolley right next to the child. Now, I've been in hospital before, trolley, bed, really very, very similar things. We're not talking about, sitting in a supermarket trolley. A hospital trolley is a bed to all intents and purposes. There are some question marks being raised about this now.
That's an attempt to sweep the story away.
No, it's not. It's me being a journalist and looking at both sides, Scott.
I'm sorry. That's an attack the messenger story. This was not a staged photograph. This wasn't a staged situation. The mother didn't stage it.
How do you know that?
Oh, how do I know that? Because there's absolutely no evidence that the mother sat there and said, all right, I'm going to put my child on the floor. Now I want you photographers to come in, and I want you to do that.
No, Scott, I'm not accusing anything. I'm just saying there are a number of medical professionals, there are reports, and I've said unconfirmed reports from nurses within the hospital that what she said happened did not happen.
I don't play unconfirmed, Julia. I play with what is before us regarding not only this case, but many other cases.
The wheels of a hospital trolley are in the photo.
The wheels of a hospital trolley in the photo then sweeps away the fact that the boy is on the floor and that others who are in hospitals across the country have had to wait as well. Stick with the issue that comes up here, which is ask both Conservative and Labour, ask Lib Dems, ask all other parties about the state of NHS where you don't have this situation where not only 4-year-old children, but men and women of all ages are having extended waiting times, where you have pressures on doctors and nurses. Both your guests there have acknowledged that the NHS is under pressure. The question is how you fund the NHS and pursue it. And the fact is that Boris Johnson, when confronted with this, it wasn't just a question of not empathizing with the boy. When he was not on script, could not actually deal with that question of where you go with the NHS.
There's some questions being raised there about this photograph from a lot of medical professionals saying that he wasn't treated on the floor and the mum placed him there. Some even within the hospital saying that she placed him there to take the photo and then put him back up on a trolley. It gets very difficult for us ordinary voters to know what's true and what's not during an election, doesn't it?
Well, I think actually what most voters know is when they try and get a doctor's appointment, they can wait 10 days, 2 weeks. I had to go and see my doctor a few weeks ago. It was 10 days. I mean, and
well, there was presumably because it was not an emergency. I mean, we live in the same sort of area. My GP doesn't make me wait 10 days.
Yeah, but that isn't what it used to be like 30, 40 years ago when you could just turn up and you just join the queue and wait and see the doctor. And I mean, literally, I have never seen the NHS in such a bad state. And basically, I first worked at the Royal Marsden Hospital when I left school in 1962, and it just seems worse now than it was then. I mean, literally, this undermines our lives more than anything else. I mean, no, that's not true. Education, undercuts in education that we've seen are causing so many of our kids to end up with no real prospect for the future at all. And I think what's got across to people I mean, I know everyone says, oh, Jeremy can't possibly pay for all the things he's promising.
Do you think that Boris Johnson's handling of this, when he basically refused to look at the photograph that was being shown to him by reporter Joe Pike from ITV, and then bizarrely put the phone in his pocket, do you think this will strike a chord as sort of a key moment in the election? And does it tell us anything about Boris Johnson?
Well, what it certainly tells us is that when Boris Johnson goes up and down the country saying how much he's committed to the NHS, that the fact is that at the moment in the NHS we have the longest waiting times since records began. And I think there's general agreement. I think the King's Fund were reporting on this, that the level of funding going into the NHS isn't adequate. That if we have a bad winter this year, it'll probably be the worst one on record. So all of the indicators suggest that, the NHS does need investment, and that's why the Lib Dems, we have put forward the idea of a 1p in the pound increase in income tax. And, you've just been talking about the taxes and whether some are popular or not. I believe that a tax that of that scale, £7 billion extra, is something that people would actually welcome, because they would know that it was going into the NHS and social care.
So we've been talking a lot this morning about this little 4-year-old boy and seen photographed on the floor of Leeds Hospital. But there was something of an aftermath to this. And again, a lot more claims and counterclaims.
Yeah, I mean, one of the most absurd claims was Boris Johnson claiming not to have seen the photo, which was on the front page of the Mirror yesterday. ITV's Joe Pike interviewed him, said, what do you make of the photo? He said, I've not seen it. Joe Pike said, well, it's here on my phone. Do you want to look at it? Boris Johnson, weirdly, then wouldn't look at it at all.
And weirdly, he had already done an interview earlier that morning and in which he talked about it. So one would guess he had seen it.
He then took Joe Pike's phone and put it in his pocket in one of the weirder bits of this already quite weird general election campaign. Eventually, he sort of suddenly remembered his media training for dummies, took the phone out, looked at it, said it was totally unacceptable, and he apologised to the family concerned, which is what, if he'd done that in the first place, maybe it wouldn't have been quite so bad. Things then took a turn for the worse. Matt Hancock was dispatched to the hospital as if the poor people in the hospital hadn't suffered enough, and to try and apologise for what had gone on. As he was leaving, a sort of pathetically small group of people outside sort of shouted at him that the Tories had ruined the country. One chap in a high-vis jacket on a bicycle was sort of pointing and shouting, and a Tory advisor walked into his arm. However, this was relayed to several senior journalists, including the political editor of the BBC and the political editor of ITV, that a Tory advisor had been punched in the head. The police were called, we were told. None of this turned out to be true. Yeah. Now, part of the problem with this is I suspect that this was more cock-up than conspiracy. Things were passed on a sort of series of Chinese whispers. I mean, partly journalists shouldn't pass on stuff that they haven't checked out themselves. However, we do get in the habit of trusting sources that we speak to all the time to tell us the truth in the first place. Part of the problem is there is this conspiracy. The entire media establishment is biased against Jeremy Corbyn, and this sort of thing just all plays into it. And also just gives the impression of the Tory party campaign, with 2 days to go, is in a certain state of chaos. Yes, there's a certain
shambles involved there. But again, yes, I watched the video that came out, and there's quite clearly this man in the high-vis jacket doesn't remotely attempt to punch. He just puts his arm out. It's quite clear, and it's quite clear also that Matt Hancock, the Health Secretary Special Advisor, didn't think he'd been punched. He realised exactly what had happened. But then there also is emerged online that when it emerged that Matt Hancock was going to go there, that the Labour Party were basically saying to activists, go and get a mob outside to harangue him. One of the things that was shouted by the man in the high-vis jacket was, "You're not welcome at this hospital, you're not welcome in this country," which I thought was a bit of a bizarre thing to say. Let's turn our attention back to that little boy pictured lying on the floor of a hospital in Leeds General Infirmary. It happened on the night of December the 3rd. His mother took the photograph as she took her little boy, Jack Williment-Barr, just aged 4, into hospital with suspected pneumonia. She then took a photograph of him as he lay on a pile of coats with just a jacket over him, breathing through an oxygen mask, and she sent it to the Mirror newspaper. It's been all over the news, and of course it was a photograph that was shown to the Prime Minister Boris Johnson yesterday. He ended up refusing to look at it and taking the reporter's phone in a rather bizarre interview. But let's talk about all of that now with Niall Dickson, who's Chief Executive of the NHS Confederation. Good morning to you, Niall.
Good morning.
It's a very worrying sign that anybody would be lying on a floor in the hospital, let alone a young child, let alone one that has suspected pneumonia. We know that the Chief Executive of Leeds General Infirmary has apologised to the family of this child, saying that actually it was a very busy week and that they didn't have enough beds and that they had been put into a little ward area without a bed. Do you know yet what actually happened and why this child was treated in this way?
Not in the specific, and I wouldn't comment on the specific case in that sense. What I think the photo of Jack shows is something that I think is quite rare, but is completely unacceptable. And although it's rare, what it does do, I think, is illustrate just the huge pressures that the NHS is experiencing, that staff are experiencing on a day-to-day basis. That's certainly not rare. There are millions of patients being treated successfully, but it is a huge service, and there are places where at various times the level of care that people are being offered is not good enough. And in this case, I think it even went beyond that to a level which I think the hospital has acknowledged that it simply wasn't acceptable. But it's not an absolute one-off. Because of the huge pressures that we're seeing in emergency departments up and down the country, there will be examples where people are left far too long waiting for care as staff desperately try and cope with the huge increases in demand that they're experiencing.
Isn't one of the key issues, of course, is we've got a lot of this horrible phrase, isn't it, bed blocking? And I've had an elderly relative who wasn't able to leave hospital, and I know exactly, and moving from ward to ward, I know exactly what's been going on at first hand, that there are an awful lot of elderly people. There isn't care for them elsewhere. They end up staying in hospital. Those wards get full. The wards that feed them get full. Nowhere to take people from A&E because there's literally nowhere for them to go. So it's a question of sort of feed through from A&E. If someone could be being treated, they just simply haven't got anywhere to go after that treatment. And in which case, is this all about money? Is this all about the number of beds? Is it all about the number of staff? In which case, does throwing a few more £1 billion at this, does that solve the issue? Or is there something else that's also going wrong?
Well, I think you're right. There's something more fundamental. But let's be clear. We focus in on the emergency department where, terrible things occasionally happen, and certainly there are large numbers of people who are not being treated as quickly as the service would like. But the reality is the reason why hospitals are experiencing this huge pressure at both ends, as it were, both in terms of getting people out and in terms of people coming in the door, is because we haven't, and this is not just this government, it's a long-standing thing, we've not invested sufficiently in social care and in the community where we could help to alleviate some of the pressures by treating people earlier, by giving them better joined-up care and managing people in their own homes. And the service is not geared up to do that. There are plans, absolute plans to take that forward, and that's frankly where all the parties do agree, although they won't talk about it.
Are there absolute plans? Boris Johnson said when he arrived in number 10 after the Tory leadership contest that they had a plan for social care. It's not in their manifesto. No sight or sound of it.
No, you're right on social care. I meant in the NHS
right.
terms. There is a long-term plan for the NHS.
Now, obviously, an awful lot of the papers today got that picture again of the little boy, the 4-year-old Jack Williment-Barr, lying on the floor of Leeds General Infirmary. The Prime Minister's rather bizarre interview in which he took the phone, refused to look at the photograph, put the phone in his pocket before apologising and expressing his sympathy for the family. How significant do you think this moment is in this election? Does this tell us that the Tories aren't looking after the health service, or are there some questions to be raised about this photograph, how it got into the public domain and the actual circumstances of his treatment?
Well, I think first of all, obviously our heart goes out to Jack and his family, as it does to baby Lily and her family, who's on the front page of the Daily Mirror today, a baby on a chair, not able to get a bed either. And of course there's another story in The Independent of about a 12-year-old had to wait 57 hours in A&E waiting for a specialist bed. Our heart goes out to all these families. This is totally unacceptable, and I'm a parent of 2 young children. I would be angry and livid if this was my child. I'd be fighting like an absolute lion, and I'm afraid that whatever impact it has on the election, I don't know, but the key thing is we've had 17,000 beds cut in our NHS under Conservatives, and I want to say this to these parents. These bed cuts in our NHS has to stop. If I'm elected Health Secretary, I'll bring a halt to the Tory bed cuts programme.
There's no doubt at all. We have fewer beds, we have fewer doctors, we have fewer nurses per head of the population in this country than other countries. However, the interesting thing is, of course, in those other countries, the Institute for Fiscal Studies pointed out, in terms of the actual big spending on public services, they pay more taxes across the board. Your party has said, we're going to have all this extra spending and all these extra services, whether it's health, education, transport, or whatever it is, but we're not going to raise taxes on ordinary families, just the top 5% and businesses. No other country in Western Europe manages to do that. So how are you going to do it?
Well, I mean, government's about choices. And in these last 10 years, the government has chosen to give big corporations big tax cuts, and the wealthier in society big tax cuts.
This 4-year-old lad, Jack Williment-Barr, who was photographed by his mother lying on a hospital floor in an A&E, no bed available, claiming he was treated with suspected pneumonia. Thankfully, didn't have it. It's been quite a row after the Prime Minister was... He was actually, to be fair, he was interviewed yesterday morning about it and spoke about it. And then a reporter from ITV, Joe Pike, someone actually I know very well, used to work with him, lovely man, he was trying to show the photograph of the picture to the boy to the Prime Minister, who refused to look at it, took his phone and put it in his pocket. It was quite bizarre. A lot of people saying that this says more about the Prime Minister's lack of empathy more than anything else. Does he lack empathy?
Can I say that, although I'm in a car and parked up, so in case anyone worries about that, the reality is that I didn't see those because I was out campaigning all day yesterday. But no, I don't think so. I think I've been in interviews before where somebody springs something on you in the middle of it. It's very difficult to deal with something completely separate and different and being asked to look at something and make a judgment about it. It's because you can't make a judgment until you know exactly what the case is, what the details are about it. And therefore, I think the element of the interview smacked more of a stunt than anything else. And of course, all interviewers are entitled to try something like that. But I think that what should have done is that he should have been informed about this first before, and they should have had a proper interview about it instead of just springing it on him at the last minute.
Well, no, he did know about it because he'd already been interviewed early in the morning on a radio station about it and already apologised for it. There are some question marks now about how much of a staged photo it was. Some, although the hospital has confirmed there was no bed and there was a long wait. But look, this doesn't play very well for the Conservatives. Lots of concern about, again, rich Tories not caring about the NHS cuts, public services struggling. This plays very badly for your party.
Here's the important point. The government has already committed an extra £34 billion is going into the NHS, which is the biggest uplift that we'll have had pretty much in modern times. That is destined immediately for the NHS. In fact, the plans for that have already started. And in my own local area, we've now got, finally, after Labour tried to close Whips Cross Hospital in my area, we've now got an extra £400 million to go into that. To rebuild that hospital, essentially a new hospital. That's the first government in 20 years that I've been campaigning for that to do it. So there is a recognition that we now need to infuse much more money into the NHS. Of course we do. But the reality is all of this right now is who do you trust to run an economy that can actually deliver this? And the answer is that the Labour Party's plans for the economy are absolutely ludicrous. They're going to spend most of their first time raising over $90 billion in taxes to repurchase all the organisations that have been in the private sector now and renationalise them, including things like broadband providers, etc. Will have to be given their money for that as well. That's going to cost the earth, it's going to take time, it's going to cause chaos, and the economy itself will begin to tank. I think there's no question about that. And if the economy is going down, then what you're going to end up with is very little money indeed for the NHS. So you need an economy that's well run by people that are doing it properly, and we can have the kind of money we're talking about in the NHS, those extra nurses and doctors that we all want, and GPs.